Thursdays, as typical, are the time we give a little segment for the medical community here. And joining us today, Dr. Shawn Hocker, who, if I had to guess, you go about 6'4".
That's about right.
Yeah, that's what I thought.
With or without the shoes.
Yeah, there you go. I've never felt so small in my life. He's here to talk about knee pain, its causes, some treatment options. And as soon as I saw the topic for this, the first thing I thought of Jack Nicklaus. I know he had the hip replacement surgery, but with the advancements that we've had with the different, I guess, substances and bondings that you use for these things, how far have we come in these replacement surgeries?
Well, I would say that we have come tremendously in the approach on which we do them, the tissue-friendly manner in which we do joint replacement, and the longevity of them, the actual quality of the materials. A lot of excitement's been generated in the last few years about some recalls about hip replacement, and some of that is trying to push the advancements of joint replacement. There's some unintended consequences. Much like new cars and new technology, sometimes there's recalls.
Sure.
But the overwhelming majority of joint pain that we see is non-operative.
Speaking now specifically of knees, is there an age where you start to see the prevalence of this kind of kick in?
Absolutely. So you and I are in that age group.
Right.
So most knee pain generators are mild degenerative wear that we put a new activity across and/or the weekend warrior phenomenon, and it starts developing pain.
So we should let Colin know as well. He's out there running all the time.
Exactly.
Is it something, if I did something to my knee, is it something that I would know right away if it was serious enough that we would have to start considering replacement? Well,
I mean, there's a lot of things between having knee pain and replacement.
Sure.
So, the most common knee pain generator that I see are annoying meniscal tears. Now, if I looked into every healthy, happy, functioning knee in our age group walking down the street, I'd find a lot of meniscal tears. So usually I tell the people the rules of twos. So if you have knee pain that is a little bit more than normal or a minor ache and pain, you take a couple of leave for 2 weeks and twice a day elevate and ice. And if you're still having problems and swelling afterwards, then it's probably time to come have it evaluated by an orthopedist.
When you get to that position in your life where you are talking replacement surgery, what kind of options are there now?
So there are partial replacements. It means that some people have accelerated wear in only one side of the knee. And then there's total knee replacement. Now, we use the term total knee, and people have this concept that we cut out the whole joint and put in some big mechanical hinge, but we should really call it knee resurfacing, because that's what the procedure is now. We shave off 1/4 inch of bone at the end of the surface where the arthritis is, and we put caps on them. And then in between the caps we put a plastic bushing. So instead of bone on bone articulation, you have smooth metal on plastic. And so you still need your muscles and tendons that power the knee. You still need your ligaments. And the total amount of material that we remove during a knee replacement fits into the palm of my hand. So it's really a resurfacing procedure. But the generalized tenets of success for that still hold true. The most important variable for a successful joint replacement is not what you put in or manufacture that you put in, it's how it's put in. And that onus is on us.
And I always, at the end of these, I always say, if you have questions of this, don't email me, don't call me. You always want to talk to the guy wearing the white. He knows much more about this and he can answer your questions. Doctor, I appreciate the time.
Thank you very much.
Thank you.